And thank you once again for joining us. And please go to the Facebook page of ICA to be informed of other upcoming events. And now over to Shi Singh, who will be introducing the other panelists.
Hi, good morning, everyone. Thank you so much for spending the Saturday morning with us. And I'm Cixin Wang, and I am a school psychologist, and I'm a faculty at University of Maryland, College Park. And my research has been focusing on bullying, discrimination, and youth mental health. I'm so excited to offer this workshop in collaboration with my colleagues, and I'm going to have them introduce themselves.
All right. Hi, everyone. I am Dr. Nikita Rodriguez. I'm a psychologist at Children's National Hospital, and I'm also an assistant professor at George Washington University in pediatrics and psychology. And I'm also very excited to be here today to tell you a little bit more about suicide prevention, and specifically with mental health concerns in South Asian and Asian populations.
Hi, everyone. My name is Mazneen Havewala. I am originally from India. I've been here for more than about 10 years now. I'm currently doing my PhD in school psychology under Dr. Wong at University of Maryland. And in India, I used to practice as a psychologist before I came here. So I'm also excited to be here today.
Thank you. Thank you. So I will share the slides. And at the end of the training, that will also share the slide in the chat as well as through ICA. So you don't need to worry too much about taking notes because we'll share the slides. And if you have any questions, do feel free to enter your questions in the chat. Thank you. So today we want to talk a little bit about what are some warning signs and symptoms for mental illness, especially for suicide. Then we are going to go over 6 action plans. So we'll go through those in detail. But because it's only like an hour and a half, it's not going to be in a lot of detail. And there will be resources provided at the end. I want to mention that COVID is really a very challenging time for parents as well as kids. You can see from on your right side, this is and it's a survey done by American Psychological Association. You can see like 70-something parents said that they are very stressed out during COVID, especially because at the beginning of the COVID, kids are at home and there's a lot of changes in routines. And similarly, that kids also feel a lot of stress. And we don't have, like later on, we'll talk about rates of mental illness, but those data were collected way before COVID. And I think the number is probably higher. But you are so important for your children's health. And you are here because you deeply care about your kids. So we really want to say thank you. And the intent for the workshop, when we give tips, it's not to blame parents. I'm not trying to say this is wrong, you shouldn't do this, but present as an alternative way to think about youth mental health and parenting as an immigrant. Like I am a Chinese immigrant, I grew up in China. And so I noticed that a lot of time that the way I brought up by my parents is different from how other parents treat their kids. I have an 8-year-old and a 4-year-old. Then I notice, I start to think about like when I do certain things and if it's to the best of her interest. And we will share some research supported strategies. And so this is data that published in 2010. So it's an epidemiological study looking at the prevalence of DSM-4 diagnosis in the US. And they interviewed more than 10,000 kids in the United States, a representative sample. Lots of numbers here, but if you go down to the bottom, so if you can see my mouse, you can see 22.2. So those are the kids, adolescents with mental illness with severe impairment. So that's 1 out of 5. And if you look at this number here, 49.5. So this is the number of kids who have mental health symptoms, but they may not have very severe impact. They might have a mild impact on them. So what does that mean? Like 49.5, that's almost like every other kid during adolescent years experience mental health symptoms. And 1 out of 5 of them have very severe symptoms and significantly impact their school, relationship, and daily functioning. So when I first saw this, I mentioned this, I showed this to lots of parents in my previous workshops. Many parents were surprised to know that the prevalent rate is so high. And this is also a new report come out 2019 by National Academy of Science, Engineering, and Medicine. So the new find, they always publish report to say which group is at risk. And in 2019, in this paper, they say that students in high achieving schools and now are considered as an at-risk group. We tend to think kids with mental illness, one of the risk factors might be low income, right? Parental divorce, stressful life events, low SES. But now this National Academy added this high achieving school to a risk group. Why so? Like a lot of parents wonder, like, why is that a risk factor? Isn't high achieving school an excellent thing? We want kids to be in high achieving schools. That's why many parents move to Howard County or move to Montgomery County. They want kids to go to schools. But in their report, they find that kids in high achieving schools experience a lot of pressure. They face record low acceptance rate at top colleges. And especially during COVID this year, lots of applications, acceptance rate is lower compared with before because lots of kids applied. And many students feel tremendous pressure to achieve and the resume build in all aspects of their young lives. Like in high school, those AP classes become really competitive. And the things that used to be fun and like playing a musical instrument or a sports now have become a means to an end, that end being a sport at one of those countries' most competitive colleges and then on a prestigious high-paying career. So you can see if you are in a high achieving high school and you are in an environment to really have a lot of pressure for you to be successful. So teenagers, they might not know the best way to cope and regulate their stress, then it might trigger mental health symptoms. And the psychologists here, they interview said that our job as parents is to help our children feel unconditionally loved so their self-esteem does not rest on the slender of their accomplishments, knowing that because of this high level of competitiveness, they might not win all those games, but they are still unconditionally loved by their parents, by others, and they're still a good kid. And last year, in around October, one of the high school students in Thomas Jefferson High School, which is a very high achieving school in Northern Virginia, committed suicide. And one of the psychiatrists at a workshop, he said that he graduated from this high school. And when he talked to his friends from the high school, they say that they felt the competition at the high school was so intense, and it was more intense than the medical school they went to. So kind of think about that. Like we will think medical school being very high pressure, lots of work, and the job they do is very high stake. But when Dr. Chang was thinking about his high school years, he felt like the high school years, the competitive, it was more intense. So is that the best use of time for our kids at high school? And he suggested that parents, we need to ask us, so what's the most important thing in life? And what are the costs for kids' success to be in TJ or to be in those top schools and top colleges? And as a parent, I also think it's important for us to think, like, what do we do? Like, how can we support kids academically without putting too much pressure on them, without at the cost of their mental health? And I want to share some more data related to COVID. So in this Young Mind survey, they find that 83% of the youth they interviewed, they surveyed, they said the pandemic had made their mental health conditions even worse. And in a survey I did at University of Maryland, that we find more than 40% of the college students in our sample reported moderate to severe level of depression and anxiety. Of course, it's April last year, it's very stressful. School just closed down. And hopefully situation will get much better as campus reopen in the fall. But it says like it's 40%, it's moderate to severe, so it's not mild. So during COVID, it just increased the risk of kids having mental health symptoms. And for Asian Americans, we experience another challenge, that's discrimination or anti-Asian sentiment that were kind of triggered by the COVID. And we have in our survey with 500 parents and 240 youth, that about 50% of the youth said that they experienced racial discrimination last year. And most of them experience it like a weekly and daily basis, that including face-to-face as well as online. Like cyberbullying still occurs during COVID, even if they are at home. And the 24% report elevated mental health symptoms. So those numbers are very high and very concerning. So I really appreciate everyone being here to pay attention to children's mental health and think about ways that we can better support our kids. Some more data. So we were just talking about mental health, but not everyone with mental illness is going to commit suicide. But the suicide rates is increasing in the United States in the past decade. And especially for Asian Americans, suicide is the first leading cause of death among Asian American adolescents between 15 to 19. And the suicide death rate among Asian Americans is actually higher than non-Hispanic Black as well as Hispanic youth. Kind of think about what are some contributing factors, right? So we know that there may be SES, school pressure, and taking all those into consideration, Asian American adolescents, most of them are probably high school, college age. They actually have a higher rates of suicide deaths. So that's not attempt, that's death. And in another census data in 2014, so that's the lower part, they find that 18% of Asian American high school students reported considering suicide, and higher than the white students. Again, that number is 6 years ago, so we don't know exactly now. And so when we look at second generation Asian Americans together, we find that second generation Asian Americans have higher instance of mental health disorders like depression, anxiety, compared with non-immigrant, non-Hispanic white. So there is this immigrant paradox. Like immigrants themselves in first generation, they tend to have better mental health, but their kids like second generation and the third generation tend to struggle more. We don't know exactly why, but for many parents, that's something we want to pay attention to. But the good news is mental illness can be treated. 90% of the mental illness can be treated with a combination of medication, therapy, and other support. So it's not the end of the world if the kid, 1 out of 5 kids have severe mental illness, because there are evidence-based treatment that's out there. However, even though there is evidence-based treatment that's out there, Asian Americans as a whole, regardless of age, we are less likely to seek and receive mental health services compared with non-Asians. So it's not only for kids, it's across age groups. Why do you think that's the case? Feel free to type your ideas in the chat. I'll just give you 10 seconds to kind of think about it. Some people say maybe we kids or parents don't know it's depression or it's ADHD, so they do not seek help. That's definitely one reason. There's also reasons related to stigma. So like people have negative attitude towards seeking help. And because as a society, there is stigma towards mental illness, and the stigma is even higher among ethnic minority communities. I can give an example of myself. Like my daughter was, when she was young, she's even now, she was still very, very picky. So I worked at Kennedy Krieger as a psychologist before. So I took her to the behavior psych clinic, and there's an eating clinic to seek behavior therapy to kind of help her when she was 2 years old, to get her some skills to eat better. And I told my mother-in-law that I think, instead of say, I think there's maybe some behavior issues, we say that we are concerned about her ability to chew, like maybe that her tongue or something is not functioning well, so she's not able to chew and swallow. That might be why she's underweight and she's not growing. But the reality is it's a combination of biological as well as a lot of behavior stuff. Why did I say that? Why did I not say we just go to see a psychologist? I think it's about stigma, even though I work there myself. So what I'm trying to say is stigma is pervasive, and sometimes our kids refuse to seek help. They don't want to see a psychologist. They are not they will say, like, why do I need to see you? I'm not psychic, or I'm not a psycho, because they are influenced by this broader stigma towards mental illness. And then if they don't want to seek help, parents don't want to seek help, then they are not receiving the help at an early age. At like an early time when they need it. And as US as a total, we know that youth as well as young adults, there is a long gap between the early onset of symptom and seeking help. And the wait is between 8 to 10 years in one of the study, meaning that if the kid have symptoms at 12 and parents wait till when they are 22 to suggest them to seek help. But lots of things can happen in 10 years. The situation might deteriorate, it might get severe or get worse. Like if you have a back pain, do you wait 10 years to see a doctor? Or if you broke your arm, and will you wait 8 years to see a doctor? You probably won't, right? But we tend to wait for a long time, as in general, not only Asians, other groups do too. But I think stigma and lack of mental health knowledge definitely contribute to that. And for immigrants, for Asian Americans, there's also the structural and the practical barrier. There might not be many providers who speak your language. And the parents, sometimes they are concerned about confidentiality. They worry that if my high schoolers go see a psychologist, will that impact, would that be in their records, or would that impact his college application? The truth is that we have HIPAA, and all the medical records are confidential, so nobody else will see it. And if you see a psychologist or a counselor at school, and then there's not really a note, and it's usually, even if there is some record notes, that it will not be in their academic record. So you don't need to worry about that. When they see their transcript, it will be there. It won't be there. And there's also lack of parent support and communication about help seeking. So teenagers feel like their parents do not support them when they want to seek therapy or seek counseling.
Yes. All right. So I think this transitions well, because we are here today to talk specifically about suicide and some of the risk factors we see for suicidal behavior. But like Dr. Wang said, we don't want to only seek help for our children once they're already at the point where they're considering suicide or they have made an attempt to end their life. We want to try to catch things before they get to that point. And so in order to do that, I'm going to talk a little bit about some of the symptoms of depression. So you can try and see if you're picking up on some of these things before they get so serious. So when we think about symptoms of depression, we think about affective, cognitive, and behavioral presentations of depression. When we think about affective, we're looking for somebody who's seeming like they're in a depressed or sad mood. But oftentimes, especially for children and teenagers, what we see is irritability. So what I often notice is I'll get a consult to see a family and they're complaining about a teenager who is mean and always fighting with the parents and has anger issues and needs to learn how to control their anger. And then I will kind of dive deeper with the teenager and try to find out more about what's going on and see that it's really a lot of sadness that is then presenting as anger, because that's a more acceptable way for teenagers to behave. And that can be especially true for boys, but we see it in both girls and boys where we see that irritability. Kids feeling hopeless or having a decreased interest or pleasure in activities that they normally would enjoy. cognitive symptoms of depression are kind of these negative attributions where you kind of expect things to be bad all the time. You're filtering information to only take in the bad parts and not the good parts. You might have some distortions where you misperceive how other people are reacting to you, or you are only kind of thinking about the worst parts of a situation and not trying to have a more balanced way of thinking. And then we also see a lot of low self-esteem. And we think about this negative cognitive triad because one of the big parts of depression, and especially depression that then escalates to suicidal ideation, is having senses of hopelessness about the future, really negative perceptions of the self, and perceiving really low social support from the world or the external support system that a child may have. Additionally, there's a lot of feelings of burdenness, and we'll talk about this a little bit more, but kind of having these thoughts like, I'm a burden to my parents, I failed my parents have done so much for me, I'm a failure and they'd be better off without me. And that's where we kind of see that transition from depressive symptoms that are maybe manageable to then escalating to where we're having suicidal ideation. And I saw a really good question in the chat of how do you distinguish between depression and teenage angst? And I think that's a great question because it's absolutely true that teenagers in general have a lot of moodiness. They're kind of figuring out their own identity. Low self-esteem is a little bit more persistent in adolescence in general. But what we're looking for here is, even a teenager who's angsty, they still will have times where that angst lifts and they are able to engage with their friends, or they're motivated to go out and do the things they like, or even, if all they want to do is play video games, but you can see that they get a lot of joy out of playing video games and they're laughing and having a good time. Having some periods of teenage angst is typical and fine. But when we think about depression, we're really thinking about maintenance of symptoms, where you're seeing these down periods that last for more than 3 days at a time with no lift out of it. Or the things that they usually would enjoy are no longer bringing them joy. For teenagers, it's really typical that their social lives are what they want all the time, and they want to be with friends and they want to be out doing things. And when you see kids in depression, even that, they're no longer as motivated to spend time with their friends, or when they are with their friends, they're feeling really withdrawn and reserved and not connecting with people in the same way. So those are kind of the distinguishing factors, but absolutely, teenage angst, we don't want to be too worried about. It's when that angst never seems to lift that we get concerned. All right, we can go on. And so again, that's why looking at behavioral markers can be good, because oftentimes in general, teenagers can be a little resistant to sharing what's going on emotionally or internally with their parents. And I just see that question pop up. How do you get them to open up? And we can talk about some strategies a little further into our presentation. But sometimes, you haven't, there isn't that foundation, or teens are just more reserved. And especially if they're depressed, they might not be more forthcoming in sharing. And so looking for these behavioral markers is really important. So if you start seeing that they're having difficulty paying attention or concentrating, their grades are slipping, decreased interest in things they normally enjoy, fighting, arguing more, spending more time alone. And what can often be common, especially in kids who are growing up in environments where mental health isn't talked about as much, you might see more somatic complaints. So they're complaining about stomach aches or headaches, or other like physical reasons for why they don't want to go and do things that they normally would do, or why they can't go and do their homework. And that might be a warning sign that there's something more going on. Additionally, we see changes in eating or sleeping, and this can go either way with depression. Oftentimes it looks like eating a lot more and sleeping a lot more, but it can also be the opposite, where you see periods of not really eating a lot, or times when they just can't get themselves to sleep. And those are good warning signs as well. And so if you look at the bottom left side of this graphic, there are some really important statistics there. So suicide is the second leading cause of death for Asian Americans between the ages of 15 to 24. And 17.7% of Asian American high school students reported seriously considering suicide. So I think a lot of people find that statistic surprising. So that's almost 1 in 5 Asian American high school students who've seriously thought about suicide. And so, you know, what that tells me is that this is something that we should be talking about more openly. If the chances are that high that your child has thought about this or considered it, it's worth making it a topic that we can talk about openly at home. And we'll give you some strategies for that. And then 7.8% of Asian American high school students reported having attempted suicide. And that rate is a bit higher for women compared to men. All right, we can move on. And so, you know, some of the behavioral symptoms of depression then lead to behaviors that cause longer term or downstream impact that can increase the likelihood of more severe symptomology. So again, like I said, when kids are depressed, and especially in this generation, when we're seeing kids who are spending so much time on screens and they're scrolling on TikTok all night, or they're watching YouTube videos, or they're playing video games, we see kids trying to numb out their emotions by just, you know, watching video after video after video. And this usually results in an impact in sleep. So when we think about how many hours of sleep a child needs each night, it's typically a lot higher than what we see kids are getting. So teenagers kind of on the bottom end need about 9 to 9.5 hours of sleep, and they only average about 7.5 hours a night. And this is problematic because we know that it then has impacts on their cognitive level. And so that means that they're having a harder time sustaining attention. They're having a harder time resisting impulsive behavior. They tend to eat more when they're sleep deprived and eat unhealthy things because they need that sugar rush or that calorie boost to get through the next thing. And this is also something we see a lot in high achieving students, right? Where they're trying to pack in a million extracurricular activities and all of their homework and staying up late doing all of that work, and which then leads to the work being harder because they're having a harder time with the cognitive load because their brains are deprived of sleep. All right, and so another thing to think about is chronic stress's impact on the brain. And, you know, like Dr. Wang said, sometimes we really think about chronic stress as growing up in poverty or being exposed to a lot of trauma. And absolutely, that is a big part of the chronic stress literature that we look at. But there's also evidence that even just the pressure that kids put on themselves and the stress they feel about their academic performance or about their social relationships can also impact the way that their brain functions. And we specifically see, you know, these what they call functional holes in the prefrontal cortex. So that's right up here. And this is such an important part of our brain that helps with regulation. It helps with attention control. And so we know, you know, that depression on its own kind of impacts the ability to regulate and to do goal-directed behavior. But we're also seeing now in studies that there are actual brain differences for kids who are growing up in chronic stress and experiencing symptoms of depression that has real impacts on their ability to function. All right. And so, you know, now we want to talk about the big why, you know, so a lot of parents, when I'm meeting with them, they understandably have a really hard time understanding why their child is depressed. And what I hear a lot is, I give my child everything they need. They have a million video games, and they have, their own room, and they have great friends, and we do some fun stuff every weekend. Why are they still depressed? And that is a great question, and we'll continue to talk about it throughout the presentation. But I really like this biopsychosocial model of depression, where we think about it being really a combination, where we know that some kids have biological vulnerability to emotion dysregulation. So I think what can often be hard in Asian American communities is mental health stigma has prevented identification of mental health diagnoses for so long that oftentimes I'll meet with families and they'll say, nobody in my family has a diagnosis. And then I'll say, okay, well, what do you think? Have you ever thought like, oh, grandma might suffer with depression, or grandpa was always really irritable, or he seemed to be drinking a lot, and sometimes we see these family histories of mental health symptoms that were maybe not diagnosed, but are worth kind of reflecting on to think about whether there might be some genetic mental health risk in your family. And so you might have a child who's biologically vulnerable to being more sensitive, a little bit more reactive, and have a difficulty returning to baseline. So what that means is that when they get really upset, all kids have times when they get really frustrated or throw a tantrum or get really angry, but oftentimes kids within like 15 to 20 minutes can kind of get back to where they need to be to function appropriately. And some kids just have a harder time doing that because of the way their body regulates. And so you have this kid who has a biological risk, and then what we know leads to those symptoms escalating to the point of depression or suicidal ideation is if that's then paired with a social environment that doesn't validate their emotional experience. And what's important I think for people to recognize is that sometimes that social environment with another child would have been totally fine, and that kid would have done okay, and we wouldn't have to be worried about mental illness. It's really this combination. And that's why we really want to think about tailoring our parenting style and adapting our parenting style to our children and what their needs are. And so, you can see this kind of idea of poor fit. Like if you have a child with a more dysregulated temperament, and then you unintentionally provide an environment that isn't validating their emotional experience, we can see symptoms escalate to depression. And so we'll talk more about how we can shift our environment to be more validating to kids. All right. So to move on, we're going to talk about how we know when depression is reaching the level of indicating significant concern for suicide. So when these, depressive symptoms then escalate to where you're seeing they're no longer showering, they're no longer changing their clothes, they're kind of in a real funk, and they're, they have the blinds pulled in the room. Neglect of personal hygiene is a good warning sign that things have escalated. Again, those dramatic changes of sleep habits. And again, it can be too much sleep or too little sleep. Weight gain or weight loss, a decline in school performance. We're seeing more drastic changes in mood, especially with that irritability, anger, but also anxiety and sadness. And then the more withdrawn a child is from their routine activities, relationships, things they enjoy, these are the signs that things have escalated and we might be getting to the point of an emotional crisis. And parents are the best reporters of children's mental health symptoms, because your kids so well. So if you have a feeling in your gut that something's wrong, you're probably right. And you should take the push to seek help, because when a child is really in this level of emotional crisis, it can be hard for them to reach out for help themselves. Right. And so when we think about suicide, we see these kind of core features where there's a perceived burdensomeness. So this is what we talked about earlier, where a child might feel like, I'm just a drain on my parents. I'm letting them down. My parents would be better off without me. Nobody in the world benefits from having me around. Also combined with low belongingness. So feeling like there's nowhere that they fit in, and a lot of hopelessness that they ever will find a place where they feel understood and accepted. And those two things combined can lead to suicidal desire. So having some ideations about ending life. And when, and that in itself is concerning and means that we need to be looking for additional support. But then if we combine that with capability for suicide, so having access to lethal weapons, whatever means they may have imagined, taking pills, jumping out of a window, if they have access for those things, then we get really concerned about lethality of suicide attempts being possible for this person. And what we're going to talk about a little bit in a few minutes is that these feelings of burdenness and low belongingness can be a little bit more immigrant children or kids who grow up in Asian and South Asian cultures may be a little bit more prone to these feelings because of some cultural aspects and the realities of living in a country that has a different cultural picture than the culture you're raised in at home. All right. And so, we talked a little bit about the behavioral warning signs. When I think about seeing a child who is expressing suicidal ideation, the things that I consider for really making me determine what the level of risk is are these factors here. So if they've recently experienced a significant loss, if they've been under a period of prolonged stress, they're socially isolated, if they've tried to get support for their mental health problems, but symptoms are not remitting, if there have been noticeable changes in personality or lifestyle, and then we'll get the next list, if they're engaging in any substance abuse, engaging in impulsive or risk-taking behaviors, there's a loss of interest in activities, they've made any direct or indirect statements about suicide or hopelessness, they seem kind of fixated or preoccupied with thoughts of death. And then we want to know if they've ever made a plan or made any kind of preparations for committing suicide, or if they've had any previous attempts. And what's important when noting previous attempts is it doesn't matter how likely the attempt they made was to be lethal. So even if they were scratching themselves with a pen, but they thought that that was a way that they could commit suicide, then we count that as an attempt, and we have to be concerned about their likelihood to escalate behaviors. And so we want to, if you go to the next slide, again, look at those differences, the withdrawal. And then the last kind of thing that we haven't talked about here is if they've made any plan or preparations. And so things you might see there, that they're giving away possessions, they're talking about who would take care of their pets if they weren't around. They might have written letters to people they cared about. Sometimes right before a suicidal attempt, you see this drastic change where they were really withdrawn and depressed, and then you see like a lift of hopefulness, or they're starting to express more love and caring towards family members. That might mean that things are escalating and that they're considering suicide, and it's worth asking about. And so that's where we want to get to the point that we are asking our children about suicidal ideation. And a lot of parents that I talk to get really worried that if they bring it up, that's going to put the idea in their kid's head. But research has supported that that's not actually the case. And especially for this generation, where they have access to media and things online, where it is likely that they have come into contact with some depiction of suicide even really early in childhood, you are not going to be the first person kind of talking to them about this or putting this idea out there. And it's better to ask directly than to avoid the question and miss on something that could be really important. So if you see some of these warning signs, sitting your kid down and saying, you know, I've noticed that you have been really sad lately, that you've been more withdrawn, that you're not doing the things you usually enjoy, and I'm really worried about you. Are you thinking about killing yourself? And again, parents might worry that if they ask this question and they hear yes, well, what am I going to do about it then? And so, you know, what's important is we know that suicidal ideation in general is fairly common and doesn't need to necessarily mean that you take your kid to the emergency room and get them put in inpatient. You need to ask the follow-up questions to find out whether it's escalated to the point where they have a plan or any intent to act on their suicidal thoughts. So have you decided how you would kill yourself? Have you decided when you would do it? Have you taken any steps to secure the things you would need to commit suicide? And then also assess for any risk-taking behavior that might increase their chances of acting impulsively. So have you used any alcohol or other drugs? Have you ever done anything to purposely hurt yourself or to try to kill yourself in the past? And those questions can be hard, but they're important and could lead to helpful conversations that will give you an idea of what level of support your child needs.
And another way to do it is you can do a free screening. So this is the Signs of Suicide screening for parents. So you can select statement that fits how your child has been behaving, then rate them, then it will generate a report. Then it will give you additional resources. So like some parents don't want to ask those questions, but there are other ways. So I just want to share this resource here. And if your kid is shared in verbally or in writing, and after you ask them the question, they said, yes, I'm thinking about suicide. You want to don't leave them alone. You want to seek professional help. And there are also national suicide hotline you can call, and there's a free text line they can text. So we know that some teenagers, they don't want to talk, but they feel more comfortable to text. So after you text that, then it will send you it starts with an automatic thing, automated. Then based on the risk, it can connect you to a real person. And there are other phone lines for suicide. And how do you keep your kids safe? Like this is one of the kind that one of the mom asked me, like the son was actively thinking about suicide. They went to the therapist and then he agreed to go to the ER and to be admitted and to get medication. But then he changed his mind. He refused to go to the hospital after he left. So they were driving already on the way, but he changed his mind. Then they drove home. Like mom was sitting in the garage and waiting for him to make a decision. Like parents were really worried that if I say something wrong and I might trigger him again because we know he's at high risk. So what are something that you say is wrong, right? You don't want to blame them or threaten them in order to prevent suicide. You don't want to say like, how can you be depressed and you have everything you need? Or how can you think of suicide? You are embarrassing the family. You are so selfish, right? At this time, they are so distressed, and those guilt trick is not going to help them. It's just going to make them feel more like helplessness, and they feel like they are burden to the family. And that is one of the main reasons kids might commit suicide, because they feel they are burden to the family. You want to say like, thank you for telling me this. I'm so sorry that you are feeling this way. It must be so hard to feel this way, to live this way. But you try to instill some hope. Suicide thoughts are common. Like based on the data, we know 19% of Asian American kids actively think about suicide, and 8% had attempted. So this is common. You might not want to tell them the number, but in your head, you want to tell yourself and them that those thoughts are common, but you do not need to act on those thoughts. Can you tell me more about these? What are the triggers? Together, let's find out a way to keep you safe. So it's a good transition into action plan. First, we want to understand the challenges they are facing. So there are many factors, many type of challenges, that's biological, social, psychological. So biological wise, that we know that teenager years, their brains are growing, they experience puberty, lots of changes in their body. But doesn't mean that they are fully mature. Like, when do you think teens' brain reach full maturation? Give you 5 seconds, you can think about the number or type in the chat. Like, is it at 14 or 18 or what? So research actually showed that the prefrontal lobe, the part that in charge of your decision making, is not fully mature until age 25 to 30. So most of the kids we work with on college campus, they are still within this age range. So their prefrontal lobe are not fully mature, and that they are not at their best in terms of judgment, planning, assessing the risk, and making decisions. And the stratum part, our brain, that's the reward system. Like, you really want something, you really want to do it. And that part develops first, then our prefrontal lobe. If you look at kids, the signal from stratum to prefrontal lobe is you see this dotted line, means it's not that strong, it's not fully developed. And from PFC to stratum, it's not fully developed. So if a kid wants something, you can easily distract them. That kind of tells you the reward system isn't that strong. But for adolescent, the reward system is really strong, sends message, but prefrontal lobe is not strong enough to regulate it. So when they are impulsive or when they experience a lot of distress, they want to do something, but prefrontal lobe is not strong enough to say, stop, think, don't do it. But as adults, we are grown-ups and we have better ways to regulate our behavior. So sometimes when we have a conflict with our kids, like kids might be yelling at us, say, you are the worst mom ever, I hate you, I don't want you to talk to me anymore. So we don't want to yell at them back, say, you are the worst kid ever, I wish I didn't have you, right? So we want to use our prefrontal lobe to control our impulses when our kids are being very irritable. And we did in 2018, we in the Montgomery County that we did an Hear Me Out essay contest. And we got essays from Chinese, Vietnamese, Indian, Thai, Korean, and like a wide range of Asian American kids and parents. And you can still see the essays on here. So basically we want to know what are some struggles kids are experiencing. And so we'll share some quotes.
So one of the themes found in the study was that Asian American youth were showing that there's a lot of high expectations in their families and demandings or perceived demandings for perfection. So, definitions of success were all A's, and A minuses weren't even good enough. One of the quotes was, "We are Asian, not Bayesian," right? And so if a child brought home a test with a 99% score, parent would respond with, well, what about this 1% that you missed? And so there's a lot of high expectations and pressure. Additionally, there was a lot of perceived competition or comparison between them and their peers or other kids that their parents might know. So we're going to do an activity where, we just kind of walk through a way a child and a parent may respond to each other and think about how that might impact emotions or feelings. So, A comes home and says, I got a promotion today. I will be the director of my unit, and it comes with a $1,000 bonus. And B says, only $1,000? I heard Amy got a $5,000 bonus. So you can type in the chat, how do you think that made A feel, and what would have been a better response for B? I'll give you just a second, see if anybody wants to take that on. A felt unappreciated, absolutely. And so, another way to respond might be acknowledging like, that's really great, right? And it can kind of shift the person's emotion from they might have come in feeling happy, and then now they're comparing themselves to Amy and thinking, oh man, I didn't get as much of a promotion. I no longer feel excited about this. So validate the emotion. You must feel really excited about that. And if you feel the need to talk about, well, there might, maybe you could have gotten more, you can spend some time just validating and appreciating, and then later down the road, having a conversation of what are going to be future opportunities for promotion. But in that moment, they want to feel happy about the promotion they got. So another example, my swimming score improved by 2 seconds. Parent, good, but I saw Tom's score improve by 5 seconds. Tom is always doing better than you. You have to try harder. So again, what do we think the child will feel, and what could the parent say instead? And someone made a good comment. It seems like the parent isn't even interested in their own child. They're always thinking about other children, right? And we know kids are so sensitive to having their parents' attention and what their parents think of them, and showing them that you're really interested in them. So, wow, 2 seconds, that's great. What do you think you did better this time? Focuses them on like the progress they've made, and then can transition into like, wow, I bet if you kept practicing, you could get even faster. But if we don't focus on the improvement they've made, then we've just dismissed their experience and led to negative emotions, which often then leads to withdrawal from something that they previously found enjoyable. I saw someone put in the chat, I'm so proud of you. That is so important. And we're going to talk about that more, because expressing pride, we know, impacts the way children feel. And it's something that Asian communities have been found to not express as much. And it's really important. And so in one of these Hear It Out essay contests, we had this quote, what we really starve for from our parents is a listening and understanding heart, accepting us and appreciating the way we are, products of this society they chose to raise us in. And I really love this quote, because I think it can sometimes happen where families come to America to raise their children, but want them, and I can understand where this comes from, but they want them to maintain the culture of their home country. And there should be some of that, but we should also expect that kids are gonna have some aspects of American culture as well. And so we want to validate that they're gonna be products of the society that you chose to raise them in. And we have to accept all parts of them to really support their positive mental well-being. Both my parents and I need to know how to compromise on topics we agree on. And that's going to be a big part of kind of balancing these two cultures. So somebody had asked earlier in the chat, how do we create an environment where our child talks to us? And so these are just some basic skills. One is listening non-judgmentally. And this one seems really straightforward, but I can tell you, even as somebody who is trained in doing this in therapy with my own family and kids, it can be challenging to stay in the present and really listen to what my partner or my child is saying, right? So focusing on paraphrasing what they're saying to you can be a good way to make sure that you're staying present and not thinking like, oh my gosh, they're saying this must mean this, we need to talk about this, I need to tell them this. And instead you're just trying to repeat back to them what they said. So I can understand this makes you upset. You seem really disappointed by this news. It's okay if you're angry right now. And one of the things that I hear parents say a lot is, but I don't agree that they should be, coming in and slamming their door, or I don't think that they should be allowed to go out with their friends. So I don't care if they're angry about it. And what we want to do here is validate their emotion. We don't have to validate the behavior or change what our limits or structure are. So I can tell you really want to go out with your friends and you're really angry, but that's my rule and I have to enforce it. Or I can understand that you're really angry right now. I see why, you really wanted to do this. It's not okay to slam your door, but I hear that you're angry. So you can validate emotion without validating behavior. So another kind of vignette is a child says, "Mom, Derek's parents got a divorce. He has been skipping school this week." And mom says, "I told you not to hang out with Derek. He's a troublemaker. Hang out with Tom. He's a good student." What do you think mom could have said again? Or sorry, instead. So in this example, it seems like mom really did not intake what the child was saying or think about why the child was sharing this, right? And instead moved on to like, "Oh, I've never liked Derek anyway." So if we look at what mom could have said instead, let me push forward one slide. "Really, it sounds like you are worried about him. Derek must be really sad. What can we do to help him?" And this is a great example because, we don't want to be in the situation where we are only listening and validating a child's experience when they're coming to us in distress. We have so many opportunities as parents to set the stage for us being a good listener and a good person to come to when you need help. That is way before a child gets to the point of depression and suicide. And so it's the little things. It's talking about, their friend who they're always talking about. And it's really annoying to sit and listen to it when you have a million things to do. But if you set aside the time to do that for your child and problem solve with them about their friend's issue that you don't really care about, that's going to set the stage that like, okay, my parent's a person I can go to when I need help. And so it's doing it in all these like non-important situations that then opens the doors for them to come to you when the important situations do arise. And so we think about this acronym where we can stop and pause ourselves before we react, because it's hard to change patterns of behavior without kind of consciously making a choice to, I'm going to be a little bit more thoughtful about how to respond to my child. So before you're going to say something, check in with how you're feeling. Are you feeling annoyed? Are you feeling like, I don't really want to talk to my kid right now, I've got other things to do? Recenter yourself and then say, is what I'm about to say true? Is it helpful? Is it inspirational? Is it necessary? And is it kind? Oh, you're muted.
Sorry. We might need to go a little bit faster. We have lots of slides, but those are really great tips. Thank you. And so some other quotes we got is that parents notice not only kids experience the stress, like when we say high achieving school is contribute to mental health. Parents experience a lot of stress too. Like parents want the best things for their kids, and they might believe in tough love. So you have to work hard and be miserable now so that you can have a better life. And the parents might think about in my old times, and the way for success is through getting good grades and go to really good schools. But in the United States, there are many other options. And getting perfect GPA is not the only way to success. And kids feel the pressure from parents and stress from school. And another issue that Asian American kids face is model minority myth, the assumption that Asians are all doing well academically. And related to that assumption is that kids do not get credit for doing hard work. So their peers might say that you get A's because you are Asian. So what? You are Asians and you are not Asian, so you're not supposed to get B's anyway. So this is from a college student, and he wrote that when I was in high school, I did not feel proud of anything because people will say like, oh, you aced all tests. It's because you are Asian. Then what are you supposed to be proud of? So if kids do not get recognition from their peers and the teachers, and they also do not get recognition at home, because many Asian parents value being humble and do not want their kids to become arrogant. So they are very frugal in terms of praising their kids. And so then it's really hard for kids to develop their self-esteem and be proud of themselves if nobody praise them. And think about, when was the last time you say to your kids that I am so proud of you? And so this is something that I don't even say a lot at home, but I noticed that when I took my daughter to gymnastics, like the 3-year-old or 2-year-old, the parents say, I am so proud of you when the kids come out of gymnastics from trampoline. I was thinking, what? They were just jumping. What a big deal, right? So, but you see that the kids are so happy. They want parents to feel proud of themselves, no matter how challenging they are. And those kids, they all want to be recognized by their parents. They want their parents to feel proud of themselves. And it's good for parents to recognize kids' effort. And in this quote, kids really say it's important to pay attention to mental health in our community. It's as important as our physical health. And there are things parents can show empathy when kids struggle with mental health. And some of this might be really hard to say in your own language, or you are not used to saying it. Then you feel free to say those in English. So you might say, like, you must feel so sad when this happened. I wish you didn't have to go through this. Then you probably feel really angry. No wonder you're upset. I understand. If I would feel the same way if I were in your situation. So kids want to feel understood. So by saying those can help them. And we want to recognize their effort and accomplishment. And we know that when the brain is stressed out, we saw the image, there are functional holes in our brain, right? And one way to help that is, like, when you recognize your kids' effort, say you are proud of them and praise them, and those experiences are rewarding for the kids. And those rewarding experiences make them feel a sense of accomplishment. And when they feel accomplished, the brain will release more dopamine, and they will be more motivated to do things. And the psychologist has found that as an individual, as a human being, if we get more positive feedback than negative feedback in our environment, in the ratio about 5:1, we function better, we see better, we hear better, we are just more productive. So I encourage you to keep track of your day, like today and tomorrow. Think about your interaction with your kids, how many positive interactions you have and how many negative interactions. Not only the frequency, also pay attention to the intensity. Sometimes that when we are mad, when we are blaming, or we are engaging in a negative interaction, we are very intense. The intensity is very high. And then when we say we want to give them positive feedback, we might just say good job. And when we want to be yelling at them, we say, oh my God, how can you do this? Are you stupid, right? So the intensity is also different. You want to make sure that they have more positive interaction with you than negative ones. And you want to praise the process, not only the effort. You can say that I'm impressed by your hard work researching on this essay. Your curiosity is fun for me to see. And I like the way your essay started with doing this. So it's something more concrete, then they know that you are paying attention to them and you are appreciating their effort. Oh, sorry.
The same thing. All right. So we want to try to communicate to our children that we love them unconditionally. Oftentimes we can hear Asian parents saying, you know, I brought my child to the US for the land of opportunities and so that they could be whatever they want to be. But we see Asian American youth internalizing that that's not really the case. And so how is that true, that you would support your kid and love them no matter what they wanted to be? What if they wanted to work in a restaurant as an artist, study film? Do you think your child really feels like your love for them or your acceptance and pride in them is unconditional? And we hear a lot like, what if I'm not seeing anything my child's doing that I could praise? And that's where we want to get really specific and think about just like kind of setting the tone. So even if, you know, they come and sit at the dinner table and don't talk to you, saying like, I love that you join us for dinner every night. I appreciate that you take the time to be with your family every evening. Those kind of little specific praises can lead to more and building on that behavior that they want to see. we can move on. And so one of the important things when we're talking about Asian American mental health is thinking about the impact of acculturative stress. And here we see that there are significant differences in Asian culture values versus mainstream US values. So, you know, American children are often taught it's good to question and not just be a follower, whereas Asian cultures are taught don't question, just follow whatever your parents are telling you to do. Independence is really valued in US culture and not so much in collectivist cultures. And there are pros and cons of both. So we're not saying one is right or one is wrong, but understanding the pressure that kids feel or the confusion they can feel when they don't really fit in with the culture of the country that their parents are from, but not even in the culture that they're raised in. And that can lead to kids feeling like they don't belong anywhere. Which can be very challenging. So some quotes are, I grew up very self-conscious and confused. Why can't I be like every other kid in my class? Why can't my parents be like my American friends' parents? My children struggle through cultural conflicts all alone, and I did not understand their struggles, right? It's hard for parents who haven't experienced themselves to try to really get it, but using the skills we talked earlier about of reflective listening can help you develop that empathy and try to understand. I had no idea the girls can be so mean in middle school. And, you know, I think something to note specifically for Southeast Asians is that sometimes they feel like they don't even fit in with their Asian peers, right? So they're not Black, they're not Asian, even though they are. I can tell you, I grew up so many people, even at an Ivy League college, saying to me, wait, you're not Asian, because oftentimes in American culture, we have an idea of Asian as being East Asian. And so Southeast Asians can often have a hard time like, well, I don't fit in anywhere. And that can be really stressful. So I have a couple other just little examples of this push and pull between two cultures. So, you know, American culture encourages risk taking, but Asian culture can sometimes teach us that making mistakes causes dishonor. One culture teaches us to prioritize the family unit while the other one prioritizes individualism. One culture can tell us to marry for honor while the other one tells us to put true love above all else. And again, there's no right or wrong here. It's just kind of recognizing the conflict and the stress this can put children under when they're trying to navigate where they belong when they're somewhere in between these two cultures. One of the big conflictual things that we see is, and this is true for all families, is there's a lot of conflict around screen time. So teens will say, after I do my schoolwork for a period of time, I should be allowed to do a break and do something fun. And mom might say, you are wasting your time when you play video games. Let me help you create a better schedule so that you can be more efficient with your schoolwork. And so, you know, here we want to think about how do we compromise when we know that limiting school screen time can be beneficial both emotionally and academically for kids, but there are a lot of needs met there. And so we want to make sure that a child's needs are met across the spectrum. So knowing that helping them feel loved and belonged, like they belong, giving them feelings of power, like they've achieved some things, that they have some control over their lives. Also making sure they're getting their fun need met. So even if they need to play on that video game a little bit. And then we have some needs just on survival, those basic needs that we want to provide, and giving children some freedom, especially as they're transitioning to older independence and older adolescence. They want more of that. And thinking about ways that you can structure that freedom and choice for them can be really important. Identifying fun things you can do for as a family can be a good way to build those relationships and open up those opportunities for connection. So this is a really cool website, the Family Dinner Project, that gives recipes and ideas that you can cook together, and then also conversation topics so that you guys can work together and create opportunities where you're connecting and talking as a family. because we know that research supports that kids and adults who are more familiar with family stories are more resilient, which is likely because it taps into those feelings of belongingness. And especially for children of immigrants, we know that having pride in their own culture is really protective. And so if you can talk about your ancestors and the resilience of your family, and they can gain some of that pride in their history, we know that can be really protective, and especially can kind of give them something to look to when they're going through struggles like what we're seeing with the COVID-19 pandemic, and say, you know, my family has a history of resilience and getting through tough things. I can do this too.
Yeah, we also want to think about success in a different way and think about what really contributes to children's success. When we look at this list, you might be surprised that GPA is not there, SAT scores is not there, IQ is not even there. So those more EQ type of things and that passion for doing things, optimism, gratitude are actually factors that contribute to someone's success in their when they are in their 30s and 40s. And usually that supportive but firm parents and tend to have kids who are more happy and healthy. But so if we look at this example, you might see that the kid's grades is slipping and the parent teacher called you and you feel so embarrassed and you storm to his room and yelled. And you say like, do you not know shame? We immigrate here so that you could have a good education. I would have had a better life in India or in China if not for you. And for what? The university, what did the university take a disobedient, lazy student like you? This is an example from actually a college student who's a graduate student now, but like it happened to him. But you can see like how much pressure and how the kid might feel. And what's the problem? What's problematic about the parent's response? And what would be a more productive response? So here we might see some common parenting tend to be harsh and use some guilt induction to get kids to be compliant, but or use shaming. But research actually show that shaming itself tend not to be very productive. And instead of saying, how could you be so lazy? It's better to use an I statement to say, I feel when and because and I need. So you might say like, I feel frustrated because I had a tough day at work and came home to the dirty dishes, which you agreed to do. I wish that you could help out at home more. So we will have time for other fun things. And if you don't stop crying, I will leave you behind and place you for a child who's well behaved. So those are the threats. Like parents then is not going to really do this, but they might make those verbal threats sometimes. And kids, it might trigger kids' sense of uncertainty and the low self-esteem. It's better to say, I'm disappointed when you cry like this in the store. I wish, I need you to do this. Someone might say, be it for bad, when your sister did this project last year, you got an A, versus I'm upset because I believe you are more capable than this grade shows. Let's think about what are some things we can do to help you. And you also see this comparison. So compare within the family or within the community, like always say other kids are better than you. It's going to put a lot of pressure on the kids. And it's better to think about ways to teach and model coping strategies.
Yes. So real quickly, we know that coping strategies are developmental and kids aren't born knowing how to cope. And what is really important is as a parent, you are the best teacher of these skills. And it can be pretty common in Asian cultures for parents to hide their own emotional distress or to keep those things behind closed doors. But that's denying your children the opportunity to see how you cope and the strategies you've developed in your adulthood to deal with difficult emotions. So when it is appropriate, showing them like, I had a really stressful day at work. This is what I'm doing today to kind of reset my body. Or I just got in a really frustrating moment with this person on the phone. I need to take some deep breaths so I can communicate appropriately. Modeling that for them is the best teacher. But then there also are things available online for support in teaching your children coping strategies that can be helpful. And so, you know, we have some different coping strategies. This one, belly breathing is one of the great ones. There are lots of videos on YouTube about this. Looking for the situation through a different lens. So one of the good ones could be like, if your friend was feeling this way, how would you talk to them? What would you say to them? Reminding them of all the good things that they're doing. And then modeling that positive self-talk. So if you're in their ear saying like, I know you're strong, you can do this. I know you're such a hard worker. When you put your mind to things, you succeed. They're going to start internalizing that and saying that to themselves.
So there are some self-help strategies, and because parents play such an important role in supporting your kids, and you might have seen this picture say you cannot pour from an empty cup, and we need to take care of ourselves first. So while you model those self-care strategies, you are also showing kids that those are things you can do when you are really stressed out. It can be as simple as sleep, taking breaks, eating healthy diet, and exercise and other stress management strategies like Nikita was talking about. And also like in terms of interpersonal strategies, we know that getting sense of belonging is one of the basic needs. So, and the plan for some family time together, identify social support, and also brainstorm things you can do in the community to promote health. And you might practice faith and spirituality and use creative self-expression. Those can be like doing arts and crafts, and make sure that you use humor at home. Like when there's a Chinese saying that when you laugh and you are 10 years younger. So like when you smile and laugh more and you lift up the mood and you feel better. And think about things that you feel grateful to, like the gratitude is also helpful. And in terms of psychology, find some balance between work and work as well as family life, and also pay attention to your mood. Like you might model and say like, I'm really tired today and I need to go to bed early, or I just had a really stressed for a day and I decided to take some deep breaths. Like pay attention to your mood, and also share that with your kids. Say that will help reduce the stigma towards mental illness. So make it more common, more okay to talk about negative feelings and negative mood and get help. The help can be from family and friends. You might say that I'm just had a really bad day, so much at work, and I'm really stressed out, and I need you to be nicer to me. Or like you might say this to a spouse, to other family members, and you model that it's okay to request help, and then the kids can also request help when they need to. And also attend to your own trauma history. And so like things related to the stress, and it's good to pay attention to that. And the last few part is about finding mental health providers.
Yeah, so here's a good list. You know, starting with your pediatrician, it's very common for mental and behavioral health issues to be raised in well child checks. And usually pediatricians will have good screeners and referrals if they also are concerned about your child's mental health. School psychologists and school counselors can be a good idea. And then finding a therapist with your health insurance plan if you think your child needs more long-term community-based services. And there is this website, southasiantherapist.org, that can particularly find you a South Asian therapist if you feel like understanding those cultural values might be an important part of your treatment. There are lots of different websites for looking for therapists, and we'll share these slides with you at the end. Again, like Dr. Wang mentioned earlier, there are specific suicide support lines and text lines, which can be helpful. And then also additional resources for looking for signs of suicide. And so, go ahead. All right.
We just want to end this with a final remark and never lose the opportunity of a crisis. And COVID may be an opportunity for us to get our priorities straight and to rethink about family interactions in a different way. Yeah. Thank you so much for attending. And we are happy to look at some questions.
One question about, about how to get your child to a therapist when you know that your child needs help, but the child doesn't want to go to a therapist because they think it's, the stigma like we talked about. So how do we get a child to a therapist?
So when I think about that, I think doing some education about mental health can be important. So talking to your kid, just like Dr. Wang said, if you had a broken arm, you wouldn't sit there and say, I can take care of this on my own. And mental health is a biological change. Depression is a biological change in the body that needs attention just like any other physical illness. Another thing to consider, what I do is I work in integrated primary care, and Children's National's primary care clinics have mental health psychologists within their pediatrician offices. So it can be seen as part of the mental health team. And I often meet with families who are referred by the pediatrician and the kids are not sure about whether they want to do mental health services. And I'll do one session with them, try to make them feel comfortable, talk about what therapy can look like, and get some of that buy-in in an environment where they feel safe and comfortable, and then help with that transition. So you can look for an integrated primary care practice that has psychology as part of their holistic healthcare team.
That's a great suggestion. So if there are any more questions, we are happy to answer them. We have about 10-15 more minutes. We have about 10 more minutes. And I think this presentation was excellent. It was so excellent. And I really appreciated that it was geared specifically to the immigrant communities and their culture and their values. So I found it very helpful.
Thank you. Thank you. And I just shared the PDF in the chat through the Zoom. Yeah, I think sometimes it is really hard for kids because of the stigma towards mental illness to feel uncomfortable to seek a provider. But the good news is there's a lot of celebrity coming out and talk about their experience. Like Lady Gaga talk about how DBT was helpful for her. And Mike Phillips talked about he had ADHD growing up and how he overcomes it. So if your kids are interested in celebrities, find out those role models and see like how they talk about mental health and the mental illness.
So we have some good questions in the chat. And I think the first one is what I have also experienced. When a teenager canceled her birthday party with her friends, it shows social withdrawal. What can parents do?
I would use that as an opportunity for a conversation, right? So asking your child about that decision, what's going on, kind of validating to them, like, usually you're someone who really enjoys being their friends. Is there something going on with your friend group? Teenagers don't always want to talk, so that can be challenging. But so if they don't want to share with you about the friend situation, you can say, I understand that you don't want to celebrate your birthday with all of your friends. I love you and I want to make sure that your birthday is special. Is there anything that we can do that you would enjoy? And see, and maybe it's just having one friend, or maybe it's going out to a movie and not having to talk to anybody, but still being around, their family would be nice. So think about how you can validate their experience and create an opportunity where you're showing that you're a person they can talk to without being too pushy, and then kind of move to problem solving and showing that you want them to have a good birthday and what can we do that would make them feel good.
And sometimes that kids who do not want to talk might find it easier to talk when they are doing something together, like kids who like to bake, or who like to play sports, or even on the car ride, or want parents to play video game with them. So doing something together sometimes make it easier for kids to talk while doing something.
There's a question from Jennifer about how, please could you demonstrate how to apply to kids for the example in the slide? I'm not sure which slide she is referring to. Maybe I can unmute her and she can ask her question.
Thank you. So I just wonder whether Dr. Wang and Dr. Nikta to show us how do we apply to the slide. So during the slides, there is an example. So the parents just want to blame for the kids. They don't just work hard during the school because they have paid so much attention and to bring them from their hometown to US to give them offer a better education chance, but they didn't do that, try their best. So what should parents to say to them to support them?
Okay, I see. So the example, the parents was really using a lot of blaming for the kids. So there are many different ways you can say, like you can share your concern, right? Usually when parents are mad and underneath that anger, sometimes it's concern. Like say, your teacher called me and it sounds like she told me that you are struggling at school and I am really worried. I know that you used to really like math and algebra and this just looks like you are having difficulty with this subject. So tell me more about it. Is there something I can do to help you? So open it, but express concern instead of blaming. So the kid is probably not happy when they get an F. I don't think any kids will be happy when they get an F. So they are upset about it. But when you blame them, it just makes them more upset.
Thank you. That's really helpful. So I also didn't see the PDF you shared, Dr. Wang.
I don't know how to make you see it. I shared in the chat. But if you have your email with ICA, ICA will send out to the PowerPoint too.
Thank you.
Thank you so much. I don't see. I'll make sure that the link to the PDF is on the Facebook page of ICA along with the recording for this excellent panel. So you can go back and revisit the site, give it a day because it's like Sunday. By Monday, it should be up. And if you have any comments or feedback, and this was excellent. As the mother of 2 teenage kids, I could, understand so much of what was happening in the chat, which was very active, as well as what was happening in this presentation. Thank you so much, Dr. Wang, Nikita, Mazneen, for being here today.
Thank you. Thank you for hosting it.
Thank you, and enjoy the rest of your weekend. Take care.
Have a
Bye.
nice weekend. Bye.
Thank you. Bye.